And Bert here, and Tony's from Peninsula Community Health Services. Good morning.
Morning.
And Bert Pedersen from Community Lifeline. Good to see you.
Good morning.
Been a little while since we've checked in on things, and this is a good kind of partnership that's been going on. Tony, let's start with you. For folks who may not be familiar with Peninsula Community Health Services here in the Shelton area, talk to us a little bit about it.
Sure. So Peninsula Community Health Services, we all call it PCHS for short because it's less of a mouthful, is a community health clinic that's been in operation for going on 20 years at this point. Our Franklin Street Clinic and our Belfair Clinic are newer in the last couple of years, but we are a community-based clinic that is run by a board who is over 50% patients or patient advocates, so our patients are our bosses, basically.
Wow.
And we are focused on providing the same high-quality care regardless of folks' financial situation or insurance status. So we see folks on a sliding scale who don't have insurance. We see folks with state insurance, TRICARE insurance, private insurance. We kind of like to accept people wherever they are on life's journey, whether that be homeless or dealing with substance use or mental illness or chronic diseases. We kind of pride ourselves in taking anybody wherever they're coming from. Our most recent project is a mobile program that tries to take our primary care services on the road. And so we got a big 38-foot RV and kind of have primary care providers that work in our brick and mortar clinics staff that bus as it bounces around both Mason and Kitsap counties, trying to provide the same services on the fly.
Sure.
That's a great idea. It's almost like the blood buses, the blood donor buses that pull into a business or in front of somewhere, and everybody, goes in there and, in that case, donates blood. But this is such a much-needed service. That's such a fantastic idea.
Thank you for that. Yeah, no, we get confused with the blood bus with some frequency, but no, it is not dissimilar from that model, exactly.
You can find them online at pchsweb.org, which has got detailed information on all the services, including medical and dental, behavioral health, and pharmacy services. So you mentioned the mobile bus that comes down, and that what brings Bert into the conversation here as you guys roll up right in front of Community Lifeline, and it's a great opportunity for the folks who utilize those services to come out, learn more. What's the type of help that you receive, Bert, from PCHS? And this is the second time that they'll be coming down. Is that right?
Yes, and they'll be here on Monday. And what time is it?
So we're going to be there from 12 to 3 with a little break in between, and then 4 to 7. So for folks who need to come after work, they can pop over as well.
What was the response the last time the bus came down?
It was good. It was good because, again, a lot of our clients, a lot of the folks who we deal with are hesitant to go to a brick and mortar place. I don't know how many of you feel when you walk into a doctor's office and you might have taken your blood pressure that morning before you went in, and then you took it again when you get to the doctor's office and it has gone up 20 points or whatever, just because of the nervousness.
Sure.
There is. And a lot of our folks feel the same way. And so therefore, if it's right there and they see some of their fellow folks going in, they feel more comfortable about going in and sharing any of their problems and so forth like this. One of the things we've seen at least I have seen over the last 3 or 4 years, we have a number of our clients with serious health issues. They do not want to address it until it really becomes severe. And I'll just point one out. We were doing the point in time count a couple of years ago, probably 3 years ago. And some gal comes in and says, I think something's wrong with my feet. And I said, well, let's take a look at them. And they just looked terrible. We put her in a car and ran her up to the hospital. She ended up having to amputate her toes.
Oh my gosh.
She had waited until, it was too late. And so therefore, by having this partnership, we hope to have our folks feel comfortable about going in and asking and saying, hey, I need to have some things done. I need to have something looked at, whether it's my teeth, whether it's whatever it may be. And I feel that it will benefit our clients, it'll benefit the neighborhood, it'll benefit our community.
What are the types of services that are on the bus? Is it the same as on Franklin Street, or is it a smaller subset because it's a bus? Or
Totally fair question. We do our very best to have it be all the services just on wheels.
Yeah.
Some logistical limitations. For example, we don't currently carry vaccinations on the bus just because you have to keep them at a pretty exact temperature to keep them givable. We don't generally do casting just because we don't have X-ray to confirm a fracture or rule out a fracture. Some long-term contraceptions like Nexplanon and IUDs and whatnot, we aren't able to do that. But with those few exceptions, we really do just about everything else. We do diabetes, we do blood pressure, we do sprained ankles and infected toes and all sorts of stuff. As he mentioned, trying to catch it before it's too late, and so open access.
have you noticed that after a patient or a client will come on the bus, that kind of lets their guard down, that's not the right way to put it, but kind of gives them the comfort level to then seek perhaps further treatment in one of the building facilities?
That is certainly our hope. There's only one bus currently, and so it can't be everywhere all the time.
Yeah.
And so our hope is to break down the barrier of all the paperwork and that first, engagement of the system, and then they'll have a chart open and they don't have to reinvent the wheel every time they do come. So if they go to our Franklin Street clinic, for example, they'll have a chart already started. They'll have a list of things that they're working on, and they don't have to wait till the next time the bus rolls through.
Sure.
They can go Monday through Friday, 8 to 5, at any time to engage those services, which is hopefully helpful.
And these services seem to be bringing back an element that's largely missing in medicine, and that's the human element. We went to our doctor yesterday, great guy, he's in private practice, and he had a colleague that got affiliated with a big group of doctors, and he says it's all over for him now in terms of that personability with the people, because now they dictate to him. And I didn't realize this is how it worked, but he was being very honest with us and candid in the office. He said, now that doctor is going to be told, you have to see 20 people today. You have to see 20 people tomorrow. And our doctor will spend 90 minutes with us. And we're like, how is he doing this? And that's how he's doing it. It's kind of like the old school way of doing it, where if the doctor spent 2 hours with you, he spent 2 hours with you. And only booked maybe 3 people that day instead of just this mill of people going through. And that's what I really admire about this. It seems like you guys are really putting a human face on this.
We are trying to do that for sure. It's
sorely missing. I mean, that's one of the biggest stresses of healthcare, I think, aside from the outrageous costs of some of this stuff.
And that is why, having been at PCHS for over 10 years at this point, I do take great pride in working here, because we do our very best to engage folks wherever they happen to be. As I mentioned, financially, we try to work with you and we slide the scale of the visit to what you can afford. But also just time-wise, we try to do what we can to address your needs. And worst case scenario, if we can't tackle everything that time, we can at least kind of organize our ideas and then keep working together till we get it all sorted out. So
there's a couple times on Monday, 12 to 3, and then 4 to 7. Is this a first come, first served basis, or Bert, are you encouraging, or is there a sign up process?
It's a little bit of both. So in order to make it be a success, we try to have as much gauge of interest before we arrive, so you can very much schedule with the bus. We do hold some slots for folks who are walking in, because that's the whole point. We want to have some availability to folks who otherwise wouldn't engage the system, but for folks who know that they're interested, we can schedule as well. And certainly anything that we can't schedule or address in the bus, if someone engages us, we can try to get them hooked up with an appointment at Franklin Street and help with paperwork and that sort of thing to get the ball rolling as well.
Sure. Well, Bert, it's always good to see you, and we'll continue to spread the good word of Community Lifeline. Tony, it's nice to meet you. Whenever I'm up in the Belfair area, PCHS always seems to come up in a very positive light, so that's good.
Grateful to hear that.
Good things happening up there. Peninsula Community Health Services at pchsweb.org. We'll put the links to this in the show notes when we post this. But again, Monday, the mobile bus will be in front of Community Lifeline from 12 to 3, and then a break, and then back from 4 to 7 for folks who would like to come and get seen and talk to some professionals there. Thanks for coming on.
Thanks for having us.
Good to see you guys. One more thing, Bert. What do you got?
One more thing. Our shelter opens overnight. Shelter opens on October 1st for 7 straight months.
Oh, that's right. It is, and it's getting close to those
so
colder
we have
temperatures.
An additional month this year, thanks to the county and the city. And,
Another month on both ends?
no, just on the
Just
on the front end.
on the front end.
You know,
Okay.
because just like if you're out right now, it's a little nippy out.
Yeah.
And
Yeah.
when that rain is coming down,
Yeah.
it's definitely uncomfortable.
Sure.
Oh, that's good to know. So that is October 1
October 1
starting to be
through
open.
the end of April.
All right, cool. Well, thank you, Bert. Thanks, Tony. Thanks for coming on.
Thank
Take
you.
care. Thank you.